Thank you, Mr. Speaker, sir. Mr. Speaker, sir, before I get into the substantive answer of the substantive question, I just wanted to fact check two things, Mr. Speaker, sir. It's critically important. One of them, the first one in particular, because the civil servants who are responsible for this are very upset about it. Honorable Tikunduan Dua had mentioned that, and I quote him, government wants to manipulate a captive audience that takes their personal data using the digital Fiji infrastructure, which includes digital television, apps and wireless hotspots. Mr. Speaker, sir, this statement is actually very far and wide-reaching and in fact demonstrates he does not understand what is happening. There is no taking of personal data, as erroneously stated by him. In order for us to provide e-government services such as online registration of a newborn, online registration of a company and online registration for COVID-19 vaccine, a person needs to give their personal details. Consent is required for disclosure of personal data. We verify and confirm the identity of the person for the sole reason to provide the correct service. There's no taking of data as such. In fact, all the members here, Honorable Linda Tambuya, who is very, very popular on social media, for her to be on Viber, everybody to be on Viber, on TikTok, on all sorts of other things, you have to give your personal data. When you actually get this phone going, you give your phone number, you give your address. There's more data given of your person to these phone companies than even to government. It's incorrect for him to say that. He also stated, Mr. Speaker, sir, that the cyber incident that took place and nothing was heard about that incident again. Mr. Speaker, sir, yes, there was a cyber incident earlier this year in April. We managed the incident, and as a result, the public-facing e-government services were back online within a time frame, and more importantly, in a quick time frame. And more importantly, we've been advising all Fijians every step of the way. In fact, 3 statements were issued by government, and this was covered by the media organizations. The first one, Mr. Speaker, sir, was on the 12th, within 24 hours of the cyber incident. And after we had made a rapid preliminary assessment on the cause of the cyber incident and our next steps. On the 14th again, Mr. Speaker, sir, within 3 days of the cyber incident, more public-facing e-government services were available. And again on the 17th of April, within 6 days of the cyber incident, public-facing e-government services were available and more than 30 government websites were available to the public. Mr. Speaker, sir, the point of the matter is that due to our swift and effective response to the cyber incident and in securing the network integrity, our ITC staff and Digital Fiji staff ensured that Fijians continue to safely access e-government services. So I fail to understand why the Honourable Tikunduan Dua is actually misleading Parliament and indeed making direct disparaging remarks about these hard-working civil servants. Most of them are actually very young. They're IT, some of them are IT geeks. Some of them are very, very proficient in their work. And I've got some examples over here when it happened in New Zealand. It took them much longer period than us to actually have it up and running. So it's a huge feather in the cap of the team at ITC, and I take exception to the fact that just for cheap political point scoring, he's actually disparaged these very hard-working civil servants. Mr. Speaker, so whilst I'm on it too, and Honourable Tambuya, please, I was not laughing at you. I was laughing at Honourable Salote Rondrondo. I don't have a problem with your dress. I know you're going to go to TikTok and make all sorts of allegations. But I want to get to Honourable Gerengere Tambua and others who have made statements in this Parliament as Minister responsible for information. It is my duty and responsibility, because I've been sitting here listening to it the past couple of days, about articles run by Fiji Sun on a former Minister of Fiji First. Mr. Speaker, sir, the issue about them running any front page is nothing to do with government. That's their choice, Mr. Speaker, sir. But what really baffles me is the very high, the mightier-than-how approach taken by members of the opposition in this respect. And let me put it into perspective, Mr. Speaker, sir. Firstly, government does not tell Fiji Sun what to put on the front page. Secondly, we don't really care what they are printing about somebody's personal life. The person is no longer in the party. Thirdly, to actually imply, and the hypocritical position that's been taken by the members of the opposition. Mr. Speaker, sir, Fiji's newspaper articles are replete with what would one call affairs. The Fiji Times led the charge. Remember the tea lady incident? Front page, 2-3 days about a former prime minister. Full on. None of these people condemned it. But more importantly, what I found really, Mr. Speaker, so hypocritical, not just members in this House, but outside some of the NGOs and women's groups, they did not care about the women involved. They did not say anything about them. Why? Because they simply maybe commoner women. The tea lady incident. The other one was a golf house incident, what they call the Kama Sutra incident. Nothing about that. Again in the newspapers. Number 3, in social media recently,
Order.
Mr. Speaker, sir, and the members of the opposition, women opposition, have not said anything about it. One of your own people, about the car park incident. Nobody has come to her rescue. Nobody has come to her rescue. None of the opposition people, none of the people outside this House, who are making comments, and recently a executive of a company who was charged by police, unfortunately he got off on a technicality. The lady had also gone to the Women's Crisis Center, we understand. Nothing happened. Nobody came to the defense of that lady. Nobody commented that this person has got away, gone off to New Zealand, making comments from there. Why? Or is it because he's anti-government or made anti-government comments? That's why they're not saying anything about him? Why aren't they saying about all these other women? I should take my hat off to those women because they were publicly dragged into this incident because of those politicians. But they do not utter a word. They do not utter a word because it's politically expedient for them to do it now. Not politically expedient for them to do it then. Even the car park incident issue, you are not commenting on it because you see them as the political nemesis. That's the problem. That's the problem and that's the hypocrisy. Mr. Speaker, sir, I'd like to get back to the issue. And Honorable Gerengere Tumbo, you should make note of that. Mr. Speaker, sir, the Fijian government has so far, Mr. Speaker, sir, directly spent over $350 million on COVID-19 related expenditure to assist Fijians who have been impacted by COVID-19, Mr. Speaker, sir. Mr. Speaker, sir, as part of that also, we have engaged as part of the new scheme developed by the Fijian government to improve access to medical services during the pandemic. Under this scheme, the GPs and communities offer free medical services to Fijians who usually go to a public health system. They go to a health center or they go to a public hospital because they cannot afford to go to a private doctor. So, Mr. Speaker, sir, as part of that, you would see in the budget we've allocated $5 million for 2021-2022 budget, which is allocated for this particular program. We had called for expressions of interest, Mr. Speaker, sir. 24 expressions of interest were received. And I'd like to give a bit of background. When we called for expressions of interest to this particular scheme, which we thought would be good, the Fiji College of General Practitioners decided to do what we call a monopolistic move. They said that we will charge the same rate for all the doctors everywhere in Fiji. And I think they originally quoted it was $25 or $20 a visit. We said no. We cannot have a one price fits all, because a GP who may be renting a shop or for his or her medical practice in Ba, the rent they pay in Ba is very different to the rent one would pay, for example, in downtown Suva. So it has to be individually priced. And we saw some of the pricing. We know one doctor who normally charges $10 a visit in Nosori, when he quoted $25. $25. So, Mr. Speaker, sir, those who actually got out of the clutches of the College of General Practitioners and made individual bids or individual expressions of interest, there were 24. We found out of the 24, 17 were to our liking in the sense that the pricing was right. They were reasonable, and I'd like to thank all of these practitioners, and I would actually like to read out their names also. Mr. Speaker, sir, there are 7 in Suva, Nosori, Nandera area, 5 in Nandi, 1 in Lautoka, and 4 in Ba. It goes to show that the doctors in Lautoka, there's not much of an uptake. Mr. Speaker, sir, Fiji Care, which already provides services to government for microinsurance policies for farmers and those in the social welfare scheme, is agreed to oversee this particular scheme for us. Oversee in the sense that they will verify the claims that have been made by doctors, because that's the area of expertise. That's not an area of expertise of ours. And of course, then for 1 year, they're doing it for us for FOC. And then in the future, we'll see, we'll call for expression of interest for that too. Mr. Speaker, so under the scheme, any citizen that usually does not go to a private doctor can go to these doctors. They get services from these GPs, Mr. Speaker, sir. They get consultations, they get reviews, referrals, they get injections or dressings and any other minor dressings. Whatever fee is charged by the doctor, they don't pay. Government pays on behalf of the citizens, Mr. Speaker, sir. So in a way, we're also decentralizing the services. It reduces the pressure on the doctors and nurses who are already feeling the pressure because of COVID-19 in the public health system. It also means that we are managing our risk. In other words, not many people are actually crowding in one space. So, you know, with the spread of virus, it could be a lot more rampant in a crowded space and we have lots of people. Mr. Speaker, sir, we actually rolled out we signed the agreements on the 16th of June. We rolled out the program on the 28th of June. As of 6th August 2021, a total of 9,026 patients have visited these GP outlets, of which 2,610 visits were in Suva, Nosori, Nandera area, 3,832 in Nandi, more than Suva, Nosori area, 978 in Lautoka, and 1,606 in Ba. So Ba is quite a lot, and so was it in Nandi. Mr. Speaker, sir, so far, Mr. Speaker, sir, we have paid out, so the claims that have been made so far have value of $224,038. $150,000 has already been paid out by the Ministry of Economy, and the rest of it is being verified. Mr. Speaker, sir, we also have an additional component to this. Any of these people who actually now go and visit these GPs, they also join the free medicine scheme. So a lot of them, for example, weren't on the free medicine scheme. So these doctors, if they prescribe medicine, so for example, if they prescribe antibiotics, they prescribe it, they stamp it, they've been given a particular stamp, and then they can take it, the patients can take it to the nearest pharmacy and get the medicine for free. So they've been included within that particular, the free medicine scheme also, Mr. Speaker, sir. Mr. Speaker, sir, I'd like to read out the names of these doctors. They're not that many, but I think it's important, critically important that we acknowledge them in this parliament because they have come forward. Some of them have reduced their fees. They're willing to help government. They're willing to help ordinary Fijians to be able to, access these services. Mr. Speaker, sir, in the Suva area, the first one is Koroi Surgery, which is Dr. Netani Philip Koroi in Waimanu Road. The next is Makoi Health Center, which is in Makoi, Lot 2, Vunindongo Street. And they are serviced by Dr. Lalita Devi, Dr. Keshwan Nadan, Dr. Atishay Prasad. The next one is Bay Health Clinic, which is in Rodwell Road, Dr. Sarika Shalini Chandra. The next one is Sen's Medical Center at FNTC Road in Narere, Lot 40, Dr. Shanita Devi Sen. Next is 5 is Om's Medical Center in 10 Luke Street, Nambua, Dr. Om Prasad. Next is in Garase Street, Nandera, Lot 67, and these are in really heavily densely populated areas. Rubina Medical Clinic and Research Center, PT Limited, Dr. Roy Farrells, and Dr. Muhammad Wahid Ali. 7 is the Pacific Specialist Healthcare PT Limited, 107 Foster Court, Foster Road, Walubay, Suva. Dr. Basharat Munshi, Dr. Senson Fosanga, Dr. Voy Solomone, Dr. Gurpreet Kaur. In Nandi, Mr. Speaker, sir, is Health Masters PT Limited, Lot 2, Shop 2, Bulawai Subdivision, Votwa Levu, Dr. Ahmad Shakil Sharif, Dr. Shudishka Singh. 9, Mr. Speaker, sorry, Nandi, the next one, Nandi, is ACE Medical Clinic, which is in RB Jet Point Complex, Matintar, Shop 1G1, Dr. Kana Gounder, Dr. Nahina Naz. 10, the next one, number 3 in Nandi is Coastal Medical Investments Pd Limited / Dr. Naidu's Medical Center in Sagayam Road, Nandi, is Dr. Ashank Naidu, Dr. Komal Sapna Singh. The next one in Nandi is Family Medical Clinic, Dr. Saras Nandan, Sagayam Road, 69 Sagayam Road. The next one in Nandi is Zen's Medical Center, which is in 40 Lodhia Street, Nandi. Dr. Zen Low, Dr. Zen Min Low, Dr. Ravinesh Gaunda, Dr. Sailasa Misimisi, Dr. Alexander Kanan, Dr. Ryan Shankar, Dr. Keleli Nadhika, Dr. Karaleni Batamba, Dr. Tupo Rangona. Latoka, which is the only one, again, Zen is there too, and they're in 15 Drasa Avenue, corner of Nadula Street, Latoka, serviced by Dr. Arnold Sami and Dr. Agnes Boyd. In Ba, we have Dr. Singh's Medical Center, 10 Bank Street, Ba, Dr. Diva Kamlesh Singh. The next one is Al Shifa Medical Center, 3 Vaturu Street, Yalalevu, Ba, Dr. Muhammad Sayyid Riazuddin. Next one is Puritan Medical Center, corner of Bank Road, I think, Ganga Street, Ba. Sorry, the corner of the bank, Ganga Street, Ba. Dr. Ashna Shabnam Rafiq. Last again, Zen is there too, on the opposite Westpac, beside Wellcare Clinic, Ba, and it's serviced by Dr. Priyanka Chandra. So, Mr. Speaker, sir, these are the well-meaning doctors. As highlighted also, we of course look forward to working with them. We have an allocation of $5 million. It is quite interesting with the statistics that I've given that over 40 days, and the dates from 20 June to 16th, to the 6th of August, these have been 40 days. So we're spending about, if you take those 40 days and extrapolate that, we're spending about $5,600 a day in paying for these GP services, which we believe is money well spent because we have ordinary Fijians being able to access these medical services. And similarly, we have the efficiency built in. We have the ability to work with the private sector. We have the pressure being relieved of the public health system. And no doubt if it works well together, it can formulate into later on some type of national health insurance scheme that we're looking at. We're working with our development partners. We also, Mr. Speaker, sir, on the back of this, we are looking at the Aspen Medical coming online in March next year. We'll have open heart surgery available too. And last but not least, Mr. Speaker, sir, as highlighted in Parliament during budget, that we're looking at outsourcing some of the biomedical type of services with the private sector to get better efficiency. Thank you, Mr. Speaker, sir.
Thank you.